Hello, old boy. Didn't spy you out of the corner of my eye. Having a spot of bother with Gabapentin? Not to worry. My associate will take you right through it. Just playing a little bit of darts, the Queen's game and all. Triple 20? Again? Ahoy. You want to know about Gabapentin? I shall facilitate. Buckle up. Let's go for a ride. Gabby is a 65-year-old female who lives in Melbourne with her husband Peter. She retired from her job in administration 9 years ago and now spends her days knitting, reading and catching up with friends at the pokies. Gabby has never been one to exercise regularly and always loved greasy foods and sweets. As a consequence, she has struggled with obesity for a large portion of her life, and 19 years ago, at 46, she was diagnosed with type 2 diabetes. Over the years, Gabby's type 2 diabetes has progressed, and approximately 8 years ago, she was prescribed insulin to help manage her blood glucose levels. More recently, she's begun to feel pins and needles, numbness, tingling, and discomfort in her lower legs and feet. This has now turned into a significant neuropathic pain in these areas. Gabby's neuropathic pain is worse at night and has started to disrupt her sleeping patterns. None of Gabby's family members have experienced neuropathic pain in the past. To help manage her pain, Gabby's doctor has prescribed her the anticonvulsant drug Gabapentin. Initially used as a treatment in partial epilepsy, Gabapentin is now also used to treat neuropathic pain. Randomized controlled double-blind studies investigating the efficacy and safety of gabapentin in the treatment of painful diabetic peripheral neuropathy have found statistically significant improvements in pain levels, sleep interference scores, and quality of life measures. Gabapentin increases the synaptic concentration of GABA, enhances GABA responses at non-synaptic sites in neuronal tissues, while decreasing the release of monoamine neurotransmitters. The exact mechanism of action hasn't been identified as of yet. However, its interaction with voltage-sensitive calcium channels is believed to be important. Calcium channel blocking at the alpha-1 delta-1 subunit in particular appears to be connected to neuropathic pain relief. Gabby has been prescribed a dose of 900 milligrams per day, but should be taken orally across the day in 3 doses of 300 milligram capsules. As the dose of gabapentin increases, the bioavailability decreases. It ranges from approximately 60% for 900 milligrams a day given in 3 doses to approximately 27% for 4,800 milligrams per day. Gabapentin circulates largely unbound in plasma proteins and has a volume of distribution of 58 litres plus or minus 6. Is it eliminated through renal excretion with a half-life of 5 to 7 hours and a clearance of 190 millilitres a minute. The only contraindications is hypersensitivity to gabapentin or to any of the inactive ingredients in the capsules. Precautions should be taken, as gabapentin has been associated with increasing depression, suicidal thoughts and behaviour, and unusual changes in moods. Gabby has no history of depression or suicidal thoughts, but she should still be monitored for such a change while on gabapentin. Cases of abuse and dependence have been reported with gabapentin. However, Gabby has no past history of drug dependence or drug abuse. Some of the adverse effects found in patients taking gabapentin for neuropathic pain relief include a dry mouth, peripheral edema, weight gain, abnormal gait, amnesia, ataxia, confusion, dizziness, hypoanesthesia, somnolence, abnormal thinking, vertigo, rash, and apilopia. All these problems have found to be twice as frequent in people taking gabapentin for neuropathic pain. Gabapentin has been found to cause respiratory depression and sedation when used with opioids, while cimetidine has been found to alter the renal excretion of both gabapentin and creatine, which may indicate that this impacts renal function. Gabby is not taking either of these drugs, however. She was also told by her doctor to avoid drinking alcohol while taking gabapentin, as it can exacerbate some of the adverse effects, such as dizziness, drowsiness, and abnormal thinking. The possible outcomes for Gabby on gabapentin seem positive. Studies have consistently found significant improvements in diabetic neuropathic pain while being treated with gabapentin. Obviously, negative outcomes may occur if she has trouble with side effects, but in most cases, the relief of neuropathic pain outweighs the negative side effects. The associated weight gain may be of particular concern to Gabby, as she is already diabetic. If weight gain from gabapentin becomes an issue, and if Gabby is unable to make the lifestyle changes to counteract this, a change in medication may be required. We out!